Good evening. This is the Digital Age, and I'm Jim Zirin. Tonight's program is about the number one issue of our day, healthcare reform. And to discuss the issue with us is an expert in healthcare policy. He was the principal domestic advisor to Lyndon Johnson in 1965 at the time of the enactment of Medicare. He was the Secretary of Health, Education, and Welfare in the Carter administration. He is the chairman and founder of the Center on Addiction and Substance Abuse at Columbia University. And he is the author of a number of best-selling books, the latest of which, by Joe Califano, is How to Raise a Drug-Free Kid, which is a must-read for every parent who has a problem with teenagers. Now, Joe, welcome to the
Great to be
Digital
with you,
Age.
Jim.
It's great to see you again, and welcome back. Obama wants to insure 40 million Americans with subsidized private insurance, whether they want it or not. Is this sensible policy when the federal deficit is $1.42 trillion and he estimates it'll cost $800 billion?
Well, I think it is sensible policy to cover the people in this country that are not covered. Now, how you go about covering them, whether you do with private insurance or the so-called public option, or whether you expand Medicare, or whether you expand Medicaid for poor people, that's the real question. The reality is it will cost money. There's no question about it. And the thing that really should be of some concern to people is not covering everybody. That, I think, is both a moral and practical and human imperative. It's doing it in a way that does reduce healthcare costs. So, number one, the concept of projecting costs for 10 years is absurd. And let me just give you an example. When we passed Medicare in 1965, there were no MRIs, there were no PET scans, there were no CAT scans, there was no chemotherapy for cancer, there were no organ transplants. We had no idea of those things.
Now, these are all costly procedures.
All came in afterwards.
Weren't there at the time.
Right.
And do they have an offset at all in terms of increased productivity? I mean, for example, if I get an MRI, it may prevent my having a needless operation.
It may, but the extent to which these tests are done and the exotic and expensive procedures we now have. And the other thing, Jim, that we never, believe me, nobody in the White House, nobody in the Department of Health, nobody in the social field, the incredible increase in life expectancy. Nobody expected that. Nobody anticipated that. So these two things hit. Now, to sit here today and say, okay, we can project costs for 10 years. We're on the verge of a revolution in neurology, in genetics. We have domino transplants now. You probably transplant 5 kidneys so that everybody gets the best kidney. We have people testing artificial lungs in this country. We have no idea what that's going to cost, and that's the first thing. And the second thing is the two big elephants, if you will, in the room in terms of cost are the fee-for-service system for doctors and essentially the cost-plus reimbursement system for hospitals.
Well, that went in 1965. Now, there's another factor.
We put it in.
You put it in, but there's another factor you didn't project, and that was the extraordinary inflation we had in the 1970s. So a doctor's customary fee-for-services just soared, and the costs of the hospital soared. And as we all know, cost-plus, if you ever had your kitchen redone, is the worst way to go.
Absolutely, no incentive for efficiency. And also, I mean, you're right, but remember, Nixon was so baffled by what to do, he slapped cost controls on. They were lifted the year before I became Secretary of Health, Education, and Welfare, and the first year I was in office, healthcare costs rose 22%. 22%.
And that was because of inflation.
Because we exploded. Inflation and the explosion after the price controls. Lifted the price controls, and everybody went to get their piece of it.
Now, why is the issue of universal coverage linked to Medicare? Because that seems to be drawn into the debate, perhaps through the back door.
Well, Medicare works. Whatever anybody says, Medicare works. It's not expensive to administer. It's, I think they're talking about 3% a year compared to 3, 4, 5 times that for private insurers. And the Medicare bill, incidentally, we have a 1,500 plus page. Medicare, just the Medicare part of the bill was probably, it was certainly less than 50 pages. Maybe it was about 27 pages. So that's why Medicare gets drawn. Now, the concept of saving $500 million from Medicare, in my judgment, very unlikely to happen. Very unlikely to happen, because the so-called Medicare Advantage program is a critical program to get doctors, particularly in rural areas, to stay in the Medicare program. As you know, we both live in New York. We know many doctors that won't take Medicare patients.
But Senator McCaskill investigated Medicare Advantage for 2 years, and she concluded there's no real health benefit. And why should the government be subsidizing private insurers?
Well, the government is going to subsidize getting doctors to treat people in these rural areas. That's what it's going to subsidize. It's not so much the insurer, it's what incentive does the doctor need. Look, in the real world, think about this, Jim. You put your finger on the first piece of it. In order to pass Medicare, we had to agree to give doctors their usual customary and prevailing fee.
Because you were sensitive to the charge of socialized medicine if the government was dictating fees.
Right. And therefore, doctors had the right to set their own fee. Number two, when we were fighting to get it out of the Senate Finance Committee, we ended up having to get the hospitals to at least not fight us and kill us. We had to agree to cost plus reimbursement for the hospitals. When George Bush wanted to put through the drug benefit, prescription drug benefit.
This is George W. Bush.
George W. Bush. Think about this. What did he have to do? He had to agree that the government would not have the power to negotiate with the pharmaceutical companies over the price of the drugs. So he did the same thing we did with the doctors. He let the pharmaceutical companies set their own price. I think that, you know, they're trying to figure out ways to hold down costs, but in the real world, it's going to be expensive. But I think it's something that the American people want to put their money into. I mean, people want health care coverage.
Well, let's look at Medicare. The trustees say Medicare is going to go bankrupt within the next 8 years, and particularly because of hospital costs. Well, I mean, how are we going to fix that?
Well, the issue is whether you're willing to take on the hospitals. There's a lot of inefficiency in hospitals.
Well, is there anything in the present bill that is going to curtail hospital costs?
In my judgment, I don't think there's much in the bill that's going to hold down costs. And I'll give you other examples. The other piece that troubles me is there isn't much about prevention in there. I mean, think about this. A third of healthcare costs are attributable to smoking, drinking, and drug use, mostly smoking and drinking. The diseases they cause, the cancers, the heart diseases, the respiratory diseases, the accidents that occur, the violence that occurs. Okay. There are lots of things you can do. One of the things we know is if you make cigarettes and alcohol more expensive, people are going to buy less of those products. We know that. We've seen it. We see it in New York City, the tremendous decline in smoking in New York City because Bloomberg has raised the taxes, made cigarettes so expensive. Nobody in Washington talks about it, and the House, I mean, I really call these congressmen essentially hypocrites. They say they want to control health care costs, but a majority of House members have voted to repeal the 1991 tax increase on beer.
So you would favor raising taxes on
I would
alcohol?
favor raising taxes significantly on beer and alcohol. It'll have an impact, one, in terms of teen, underage drinking. Kids will be able to afford less. And number two, in drinking generally, on excessive drinkers, it will make it much more expensive.
Let's go at it a different way from the point of view of risk, because I know you favor preventive medicine and preventive care and spending money on it, as Medicare Advantage does. I know that's why you must like it. But you take fire insurance. I pay less of a premium than you do if I have a hydrant in front of my house, and you don't. Automobile insurance, if I have a bad accident record, I pay more in premiums. And in health insurance, the premiums are not at all geared to risk.
With one exception, Jim. There are most health insurance policies, the employer-controlled health insurance policies, will charge you less if you're a non-smoker or more if you're a smoker.
That's the only exception.
Yes, and there should be more.
There should be more. Suppose I'm obese. Suppose I don't exercise. Suppose I don't go for an annual physical. I should pay a higher premium.
You should pay a higher premium for some of those things. Yes, absolutely. I mean, I think weight. It's fair to make weight a factor, unless an individual has some kind of genetic problem and that they really can't deal with it. Yes, absolutely. We have to put pain and profit in prevention. We have to make it profitable for people to take care of themselves, and we have to make it painful if they don't take care of themselves. So I think that's a very important point. There's none of that in this legislation. Now, nobody really knows. We both say with this legislation,
no one knows what it is.
Yeah, nobody's seen this bill yet, and we don't know what the power will be of this board or commission they're thinking of putting together that may be able to do things like that. And let me give you the most, when I was secretary of HEW, Medicare pays for flu shots, vaccinations, and it pays for pneumonia vaccinations. When I was secretary, about 60% of seniors got their flu shots and only about 30% got pneumonia. I suggested at one hearing that we say to seniors covered by Medicare, if you don't get your shots, which are free, and you get the flu or you get pneumonia, you pick up the tab for your health care costs. You would have thought I was suggesting hanging the old. I mean, it was such a firestorm about that. But those are the kinds of things we should do. This bill should do things like that.
Carrots and sticks.
Absolutely.
Now let's talk about the public option, which has become such a polarizing issue. Why is it that it has attracted so much heat and so little light?
Well, it's attracted heat because the issue is whether or not this will be unfair competition for private insurance companies. They've raised hell about it. It would create an enormous problem. They're highly profitable. They've become the target of the Congress and the administration in terms of this legislation. Are they the unnecessary middleman? Suppose there were no insurance companies in the United States of America, no health insurance companies, and you just dealt with the doctor, and you just had Medicare covering everybody. I mean, that's probably the ultimate objective of most liberals that are looking at this.
A single payer.
A single payer, absolutely.
As you have in Switzerland, for example.
As you have in Switzerland, and as in any case, the people can buy out if they want. They can buy out in Switzerland, they can buy out in England. Every country that has a system like this allows people to buy out of it if they want to. But I think that's a big battle. And we have no idea what's going to happen. And, can states opt out? And then you have this argument. Well, this whole thing doesn't really start to kick in until 2014.
No.
So we're talking about 5 years from now.
Is the public option dead in your view?
I thought it was dead.
What the Senator's saying?
I thought it was dead for a long time. I can't believe that Harry Reid would throw it in there unless he thought he had a real shot at getting the 60 votes he needs.
But now you find moderates possibly deserting the ship, Lieberman, others.
Well, and Lieberman, who, with all due respect, is the senator from Connecticut. Connecticut is the home of a tremendous number of insurance companies. It's not surprising to have him feel so strongly about that.
Now in America, we have a bizarre scheme of regulation of insurance companies. I mean, only Major League Baseball and insurance companies are exempt from the antitrust laws. All other business organizations are required to compete and compete fairly for their trade. Now, insurance companies are regulated by the states, and the McCarran laws, exempts them from the antitrust laws. As a result of that, they can't cross state lines very effectively to compete with other insurance companies. That gives rise to the argument about the public option, because the consumer says, there are only 2 insurance companies in my state of Alabama or Mississippi or wherever. That's not the case in New York. And I really pay much higher rates than I should because there's no competition. Wouldn't it make sense to repeal McCarran?
If you go back to if you go down to the LBJ Library in Austin, Texas, you'll see a memorandum that I sent to President Johnson in the 1960s saying we ought to repeal the McCarran Act. We should end the exemption of the insurance companies.
You're on record.
I'm on record, and there's no question that we should. Whether they'll do it in connection with this legislation, I doubt. I mean, you know, they're basically walking. It is incredibly complicated to pass healthcare legislation. Remember, as you know, what is it, 16% of the economy? It's literally hundreds of millions of dollars that have been spent. I mean, the lawyers have spent, what, almost $200 million to protect themselves from any tort reform in connection with this, which is something that I happen to think should be part of any bill. It's not.
But it's not going to be. It's not likely to be in the bill.
That's right.
And you have a tremendous amount of healthcare costs, which are attributed to so-called defensive medicine, where the doctor sends you for a test you don't need.
All you have to do is talk. There's no question in my mind, from my experience going all the way back to the years at HEW, that that's a major factor in the tests we're all subjected to.
Fear of malpractice, not because the doctor owns the MRI.
The cheapest insurance a doctor can buy is the MRI,
right,
or the PET scan, or the CAT scan.
Particularly if he owns the machine, and doesn't tell you.
But we can deal with that.
Yeah.
You know, I think there's probably authority today to deal with that in terms of conflict of interest regulations. I think Medicare probably has the power. The Medicare law probably gives the government the power to deal with that today. But you've got to recognize, there's no question these doctors order these tests, many of these tests, and there's something else they do. If you're putting patients in the hospital because you're going to operate on them, you're going to have a cancer operation or a serious heart operation, the average doctor surgeon that's doing that now will say they need more days than they really think they're going to need, because they don't want to go back and fight with the insurance company. If they only said 4 days, they end up having to do 6, and they've got to get their secretary on the phone and battle it out to get another couple of days. So they say 6 days up front.
Paul Krugman has said we need the public option in order to keep the insurance companies honest. But couldn't you keep them honest without a public option if they were allowed to compete from state to state?
There are lots of ways you can keep them honest. I mean, for sure we should repeal that exemption, but I don't know in the current context if that's going to happen. I mean, you know, Jim, you're a lawyer, I'm a lawyer. A 1,560-page bill with all these smart guys and their deep economic interests, they're going to find ways to get language in there to protect themselves.
Sure. Now, let me, even though you're a lawyer, I know you have an abiding interest in politics. What do you think of the politics of all this? Do you think Obama's gone about this in the right way? I mean, put yourself back in the Lyndon Johnson White House. Would Lyndon Johnson have gone to the Congress first to draft a bill? In '65, he presented them with what he wanted.
We did present what he wanted. But remember, he also did, there were big differences then. If you made a deal with the committee chairman, you had a deal. The committee chairman controlled the committees. That's not true today. Number two, there were liberals in the Republican Party and conservatives in the Democratic Party, so that we were able to get bipartisan support for what we did. With respect to Medicare, he basically, I don't mean to demean Wilbur Mills, the chairman of the House Ways and Means Committee, but LBJ basically played him like a violin. I mean, he got him, in 1964, in those days, the Social Security cost of living increase was not automatic. Congress voted it. We attached Medicare to the Senate Social Security increase bill in '64. It wasn't in the House bill. The House wouldn't take it. Everybody thought that, you know, well, so be it, they'll pass the increase. Lyndon Johnson killed the increase to build up pressure the next year. Then he came in with this enormous majority, and he wooed Mills. I mean, he lived with Mills.
Now,
and finally put Medicare and Medicaid together.
Now, Obama has used the internet extensively in order to try to rally public support for his plan. He's urged people to Twitter their congressman. He's urged people to go on Facebook and to spread the word that the public is behind the plan, and I'm not so sure that the public really understands the plan. Lyndon Johnson never went to the American people.
We had a terrific force, though, among the American people, because remember, in 1965, most retired people did not have health care as part of their pension plan. And the middle class, 40-year-old, was getting ready to send their kids to college, was beginning to feel the pinch of having to support their parents and provide health care for them. So we had a tremendously powerful push there. We used it. But no, it was a different world. And let me tell you, I mean, I'm sure what Obama's doing is helping in that regard. But this is really inside baseball now. This is brass knuckle politics in the corridors of power.
Would, if you were advising Obama, or if you had been from the outset in the White House, would you have suggested that he approach this incrementally and first solve the problem with curtailing costs and with Medicare, and then after he did that, particularly with all the economic problems the country is facing, didn't he make it a lot tougher on himself by making this the cornerstone of his domestic program?
You know, there's a wonderful book that analyzes all the president's attempts to reform health care. And
it's gone on since Teddy Roosevelt.
One of the key, and the only successful one is Lyndon Johnson. And I'll tell you something about Johnson.
He had Joe Califano.
But he said, I don't want any projections. I don't want. When at one point the head of the Bureau of the Budget projected health care costs out 2 years, and he raised hell and said, stop it. We're not making any projections. We're just going to pass it now. I think Obama must be saying to himself, my God, who created the Congressional Budget Office? Why do we have these 10-year projections that scare the hell out of everybody? And look, he's taking this further than any president has since LBJ, so it's very hard to fault him. And if you're interested in getting everybody covered, and I'm interested in getting everybody covered.
Well, who are these people who are uncovered? Many of them are young people gaming the system who don't want coverage. They'd rather have the income than pay insurance premiums. They feel good. They figure they're going to live forever, and they don't need the insurance yet. We're now insuring 100% of the population over age 65, thanks to you. We're insuring everyone at the poverty level, and the definition of poverty level on this bill is going to be expanded from Medicaid to 133% of the poverty level. And who's left? Who's left are, in many cases, illegal aliens, people who don't want the insurance. And this is the only case that I can think of where the government tells people you ought to have insurance, whether you want it or not.
No, we tell them they ought to have auto insurance.
Yes, but auto insurance is different, because if I'm at the wheel of an automobile, I may hurt someone, and without insurance, I can't reimburse them for their injury, and it might be my fault. So their government has a place. But does it have a place telling me I should manage they're going to manage my own health care for me?
They're going to say to you, yes, because if you don't have it, if you're not contributing in any way to this, and you do get sick or you do get injured or what have you, the other guys are paying for it. The reality here, and one of the things that makes health care so difficult, there are two very, very important factors people forget about. There is a safety net in the United States. It's a very expensive one. It's the emergency room. You get so sick that you really need a lot of expensive care. But we don't let people die. Hospitals don't let people die. That's number one. Number two is everybody wants to control costs, everybody. But if they get sick, or their spouse gets sick, or their kids, or their parents, the sky's the limit. For God's sakes, find something to save them. And I think you have to remember that. That drives a lot of what's going on here.
Well, that segues right into end-of-life care, which is the most expensive component of Medicare, is it not?
Well, you know, here's the great, crapshoot, if you will. Sure, Medicare, about a third of Medicare is spent in the last year of life, okay? But you don't know who's going to live and who's going to die. I mean, you just don't know the answer to that question. I did, when I was secretary, help Ella Grasso, the governor of Connecticut, build the first hospice in Connecticut in the country that was ever built, and open Medicare to hospice care. I provided so many, I only had demonstration authority, but the hospice thing works so well in England. And we have more and more of that. I think as we reimburse that, Jim, we'll get more and more of that.
I guess we could move on to your book, How to Raise a Drug-Free Kid. Unless there's something else you wanted to
No,
talk
I'd love
about.
to talk about it.
Talk about that. Why don't you tell us about the book and
Well,
whom are you reaching with it?
Okay.
I mean, it's a
We've actually,
great bestseller.
in a couple of months, we've got 36,000 books have been sold. The book is very colloquially written. It's based on 20 years of research, surveying teens, surveying parents, finding out what works. It's not just some guy's opinion. I wrote it, but it's based on the work of scores of researchers. It tells parents, the facets of parental engagement, the importance of parental engagement. What led to it was, we've learned that this problem of drugs and alcohol abuse is getting a kid through age 21. If you get that kid through age 21 without smoking, without using illegal drugs, and without abusing alcohol, most of them are going to drink, that kid is virtually certain to be home free for the rest of his or her life.
And that impacts our healthcare system as well.
Enormously. And those years, that's a mom and pop operation. Raising a drug-free kid is a mom and pop operation. And this book says, these are the times when your kid is at higher risk. Puberty is tougher for a girl and a boy. The first 6 months of middle school. In lower school, the kid's going to come home and say, "Mommy, stop smoking. Daddy, why are you drinking that beer?" But when he gets into that first year of middle school, he's going to see kids in the 8th grade, and it's going to be a very pretty girl, and she's going to be smoking, and there's going to be an athlete, he's going to be drinking beer. So you got to be there, because he's saying maybe it's not all bad. Maybe it's not. So, and the first 6 months of high school and the first 6 months of college, where we have the biggest increase in drinking, it helps tell people, when their kids are looking at a college, what to look for, what kind of questions to ask.
Well, I have a question for you, because we have to wrap up.
Okay.
And my question is, can Obama's plan work, or is it all an impossible dream?
No, I think something like the Obama plan, something's going to pass Congress. It's going to be substantial. It may only be half a loaf or less than that. I would take it. If it's half a loaf, I'd grab it. If it's a third of a loaf, I'd grab it. If I can make one more comment about the book, it's published as an original paperback so that anybody can afford it.
Well,
On
don't
Amazon.
miss this book if you're a parent. Joe Califano, thank you for coming by.
What a great,
It's really terrific interview.
I love being here.
And I love being with you always. And thank you for coming by. Tune in next week for more on the digital age. For the digital age, I'm Jim Zirin. Good night and all the best.